Hi everyone, welcome to the histology of the respiratory system. Let's get on with the third topic, the lung. In the previous two sections, we have completed how the inhaled air is cleaned, humidified, and warmed during inspiration, and finally comes to the lungs for gas exchange. We will now introduce important structures related to the gas exchange. We will still use Hu Chi's story to help you understand. Last time, we mentioned that Hu Chi started working and has become addicted to smoking. Regarding her asthma, there were occasional attacks, but they all resolved spontaneously. Close to retirement age, she began to cough in the morning with white sputum and felt increasingly tired. She went to the doctor, and her chest X-ray showed emphysema. She was diagnosed with chronic obstructive pulmonary disease and advised to quit smoking. In the last sections, we have talked about the histologic structures of the respiratory system, such as smooth muscles, elastic fibers, and a variety of epithelial tissues closely related to the particular functions. Then, what are the histological changes in emphysema? To answer this question, we need to know the structures of the alveoli and the lung-air-blood barrier. Let's first review this diagram. All the changes of epithelial connective tissues in the respiratory system are related to their respective functions. The simple ciliated columnar epithelium ends at the conducting portion of the respiratory system. Then, starting from the respiratory portion, the bronchioles are lined with simple cuboidal epithelium or simple squamous epithelium. The surrounding tissues only have a small amount of smooth muscles and elastic fibers supporting the structure of the entire respiratory portion. Later, R in this picture goes from the terminal bronchioles to the respiratory bronchioles, then to the alveolar ducts, alveolar sacs, and finally to the alveoli. As you can see here, from the respiratory bronchioles, the lining cells are of simple cuboidal epithelial type. It consists of clara cells in the middle functioning as immune cells. Small amounts of connective tissues and smooth muscles are also found in the respiratory bronchioles and the alveolar sacs. The respiratory bronchioles branch down into the alveolar ducts, gradually appearing at the opening of the alveoli. At the end of these alveolar openings, a small amount of smooth muscle is present, forming a nodule structure. The contraction of these smooth muscles can facilitate gas exchange. Further inside, each alveolar sac has more than a dozen alveolar openings. No smooth muscles at the end of these alveolar openings, so no nodules are formed. Then, let's take a closer look at these alveolar epithelial, which are simple squamous or cuboidal epithelial. These alveolar cells can be divided into type 1 and type 2. The alveolar epithelium is connected to the underlying loose connective tissues. They have many capillaries, a small amount of smooth muscles, collagen, and elastic fibers, as well as immune cells. Shown in the picture is the alveolus. Here we see the type 1 flat alveolar cells covering about 95% of the very thin 0.1 to 0.2 micrometer alveolar surface area. Between these epithelial cells are tight junctions which ensure that interstitial fluid does not seep into the alveoli. Type 2 alveolar cells produce surfactant, which is substance that reduces the surface tension of the alveolus. This slide shows the structure of the alveolar under light microscope. The blue arrow refers to type 1 alveolar cells, and the green arrow indicates type 2 alveolar cells. Then, let's take a look at the connective tissue underneath the alveolar epithelium, which we call the alveolar septum. It contains an extensive capillary network wrapped around the alveoli. These capillaries are joined by loose connective tissues containing elastic and collagen fibers. Finally, we come to the air-blood barrier, where oxygen and carbon dioxide exchange. This is the model of the barrier composed of alveoli and capillaries. We know that the alveoli are covered with surfactant, and below are the alveolar epithelial cells and basement membrane. From the alveolar septum to the capillary basement membrane and the endothelial cells, the gas has to pass through a total of 6 layers. Let's use the case of Hu Qi as the summary of the respiratory system. She had allergic rhinitis since the age of 6. Later, she developed a series of airway hypersensitive symptoms, including chronic bronchitis and asthma. She also had a long history of smoking. These chronic processes will eventually lead to the structural change of the respiratory system. It started with impaired ciliary cell function, then abnormal expulsion of secretions, hyperplasia of goblet cells and underlying glands, as well as increased secretions. These changes were associated with smooth muscle hypertrophy or even hyperplasia, and dissolution of cartilage slices the airway lumen becomes smaller and may even collapse in serious cases. These changes are gradual and progressive. When Hu Qi was young, she did not realize the consequences of smoking and irregular asthma treatment. However, with aging and the influence of smoking and other factors, structural lung damage will occur. By reviewing the whole development of this case, we have also gone through the key points of the respiratory system histology. Also, have you noticed that Hu Qi is the pronunciation of breathing in Mandarin? We hope that this story can help you understand the relationship between various structures and functions of respiratory system histology and the importance of early effective health education. This would hopefully enable a large number of patients like Hu Qi to still maintain the high quality life after retirement. And here are the references.